complete my remarks so you can all get a chance to intervene. And the Health Select Committee's recent report about the impact of the 2015 spending review stated, at present, the Sustainability and Transformation Fund is being used largely to sustain, in the form of plugging provider deficits, rather than in transforming the system at scale and pace. If the financial situation of trust is not resolved, or worse, deteriorates further, it is likely that the overwhelming majority of the SDP fund will continue to be used to correct short-term problems rather than support long-term solutions. The other aspect of the STPs, in order to cut expenditure, is a combination of factors, including the use of new technology, apps, Skype, patients taking more responsibility for their own health, new pathways for elderly care, increased reliance on volunteers, and the downgrading of treatment by skills, responsibilities and paybacks. It seems to me that these proposals, whilst having some merit in themselves, it is delusional to imagine that they will deal with the financial black hole in the NHS. There is no evidence that in the patient population as a whole, increased use of apps, Skype and telemedicine can produce the efficiencies required whilst beds, units, departments and hospitals are being closed. And I would remind the House, many of whom on a weekly basis speak to their constituents in advice surgery, the truth is that when you are speaking to people face to face, it's often towards the end of the conversation that they come out with what really concerns me. And my concern about the increased use of Skype is that many patients will not get that familiarity and comfortableness with their interlocutor to actually say at the end of the Skype session what it is they're concerned about. Clearly, the SDP plans talk a great deal about increasing preventative medicine. This would indeed have the effect of lowering demand for acute NHS care, but it would also require a very substantial investment in public health programmes, and this government is just not public health funding. The elderly, the poor, patients whom English is not their first language, are the least likely to use these apps and this telemedicine and Skype. It is inappropriate and unrealistic to assume that elderly patients, who I remind the House, are the biggest users of acute care and the fastest growing demographic, will want to use Skype for any sensitive matter. And new pathways for the elderly, as an idea, is sufficiently vague to raise alarm bells given the projected rise in demand for geriatric services and the continuing cuts in social care funding.